I have 1 o'clock. I'm going to get us started. Again, this is Ed Crowe. Thanks for coming on today. We're going to go over OEP rules. I'm sure most of the people on this call are familiar with the OEP and the rules, but we do get a lot of questions about it still, and sometimes people forgetting what you can and can't do during OEP. So I'll just go over that quick. Going to hit SEPs, disaster SEPs, how you look those up. Talk about different ones that are available. There's been some new ones added. There's some that are really hard to understand even when you read them. We're also going to talk about late Part B enrollment. We get a lot of questions about late Part B enrollment rules, and it's confusing because it's easy to confuse enrollment rules for Part B versus when you get Part B enrollment rules for Medicare Advantage. So we'll clarify those things. So anyway, we're going to do that. We'll talk about the FEMA site. Couple notes before we get started. Everybody that registers for these webinars, you will get you'll get emailed the recording of the webinar. I also did a webinar recently on all the programs we offer. It's 14 minutes because we get that question a lot too. And in 14 minutes, I kind of just shotgun version went through everything we offer. That's on our YouTube channel. We will also send it out to everybody that registered. And just on that point for a minute, if you can't make future webinars, but you like the topic and you want to join, but you're not available at that time, if you just register, you're going to get an email of the recording. But anyway, all our webinars are on YouTube. They're recorded. The YouTube channel, you can just Google if you want YouTube Crowe and Associates, or you can go to @Crowe Medicare. And again, take a look at the programs we offer. It was a recent one we just did a couple days ago, and you can see everything that we offer because that question comes up a lot. If you have questions during the webinar, send them in, and I will answer them for you at the end. Send them in during the webinar if you could. I'll answer at the end because sometimes we end the webinar and people are typing their question and I don't realize and I end it. So I don't want to end it while you're typing your question. Having said that, let's get started. Hopefully. Okay, so just a couple things quick. We've had a lot of inquiries from carriers. I'm going off topic a little here quick just to start, but we have had a lot of inquiries from carriers regarding 48-hour scopes, especially call recordings. And we're getting a lot of people that are getting caught without doing call recordings and not having the recording available. Usually how this occurs is it's from a complaint. If a client complains, the carrier is then going to research it, and the first thing they're going to ask is, was it face-to-face or over the phone? If it was over the phone, they're going to ask for the recording, and that's where we've had a lot of people who haven't had it. If you're doing enrollments, you can use Sunfire or Connecture. They're both available to you at no cost. It's worth taking the time to learn the system. Again, I have a webinar on a run-through of Sunfire. It's easy to record with it. Record your calls if they're not face-to-face, because sooner or later, you're going to need a recording if you get an allegation of any type, and sometimes just randomly. So recording calls, we'll hit the 48-hour scope rule first. I just want to hit that again. I get a lot of people who get confused on the scope. You are required to get the scope 48 hours ahead of time. However, that's waived for a couple different reasons. If you're enrolling somebody in the last 4 days of an enrollment period, so the end of OEP, for example, the end of AEP, maybe they have turned 65. If you're in the last 4 days, then you can do a same time scope and it's waived. You still need a scope, but it's waived. It's also waived if somebody walks into your office. A walk-in appointment waives the 48-hour scope, so you can do a same time scope. And then the other key one is it's waived for an inbound call. And Sunfire can record inbound calls. So the point is, if your client's calling inbound to your Sunfire number and you're recording it, that waives the requirement to get the scope 48 hours ahead of time. You can do a same time scope. So just good to remember that. Back to the call recording thing. If you're not face-to-face, you have to record the calls. If you are face-to-face, you don't need to record. A lot of people, as I mentioned, are getting audited with this. If a complaint comes in, it triggers the audit. The carrier will ask for the recording. And not having a recording on maybe one phone sale is, you'll have to do a remedial module usually, but they'll usually ask if you did a phone sale and there's a complaint and you don't have the recording, then they're going to go look and say, well, how many other phone sales did you have? Where are the recordings for those? And if you don't have any recordings, it can be trouble. And again, remember, use Connecture and Sunfire. They'll both record. I like Sunfire better because it'll record the inbound call. And then a really random thing, just because this comes up sometimes too, is when dating applications, I get people who think, let's say they mailed an application to somebody and that person signed it on the 10th of the month and it comes back to your office on the 15th. You as the agent don't backdate that. What you date is you date the day you received it. So in that scenario, the client signed it on the 10th, sent it back to you, didn't get to your office till the 15th. You sign and date it for the 15th, the date you received it. That comes up often. So you're always dating the day you received the app. Reminder on OEP, OEP runs January 1st through March 31st. People get a little confused sometimes as what you can do during this period. Remember, during OEP, you can change from Advantage to Advantage. You only get one change and it's the first of the next month. You can change from Advantage back to original Medicare, a supplement and a Part D if you want. And what triggers that is, for OEP, is it's the election on the drug plan that moves them to the Advantage plan. So, or moves them out of the Advantage plan. So somebody's in an Advantage, you want to use the OEP to move them to a supplement and drug plan. It's when you fill out that supplement app using the OEP election, that's what kicks them out of the Advantage plan. You can write somebody a supplement anytime. It's the drug plan that kicks them out of the Advantage. Reminder, if you're in an underwritten state for Med Sups, OEP is a reason they can get out of the Advantage because you can write them a drug plan using the OEP election, but it doesn't create a GI for a Med Sup. It does not. Now in states like Connecticut, New York, and Mass, it doesn't matter. They're all-time guaranteed issue states, but in underwritten states, we're getting people that are thinking that's a GI and it's not. So what can't you do during the OEP? Well, you can't switch from supplement to Advantage. And then the next thing you can't do, and this is the one that comes up a lot. You can't, oh, sorry, let me go back. You can't switch from supplement to Advantage. And also you can't change from one Part D to another Part D. So those are the things you cannot do during OEP. Marketing during OEP, you can market during OEP. You just can't use the OEP as the reason. So whatever way you market for clients normally, you can do. What they talk about when you can't market for the OEP is saying, hey, it's OEP, it's your opportunity to change. You can't say that. You just would market in your normal manner, and then you have the OEP election available to make a change for them. But that shouldn't slow down your marketing efforts. You just can't lead with the OEP thing. Now we'll hit SEPs. I'm going to put a lot of them in here. Some of them are basic. We'll hit the basic ones first. Of course, if you're moving from one state to another, that's an SEP. So they've got 60 days. If somebody has an Advantage plan in New York and they're moving to Tennessee, they can't stay in the same Advantage plan. They have 60 days. They have to switch to a Tennessee-based Advantage. Same thing for Part D. Supplements are different. If you're in New York, for example, maybe New York's a bad example, Connecticut, let's say you're in Connecticut and you have an Anthem sub and you move to a state that Anthem doesn't offer a Medicare supplement in, your client can keep that Anthem supplement and it'll work just fine. They do not have to switch because Anthem doesn't have a product available there. You get different scenarios where maybe you're in a Med Sup and you move with AARP, for example, and you move to a state, another state. Well, AARP then may make you switch to the AARP supplement for that state on a guaranteed issue basis because they have a product available in that state. But if you're in a sup, there's no product available in the state you move to, they cannot kick you out of it and it will work just fine. And I do see some questions coming in and I'll answer those at the end. Plan discontinuances, remember we had a lot of those this year. The open enrollment for plan discontinuance runs from, it starts December 8th and ends at the end of February. So December 8th through February. So if you had somebody who was on a discontinued plan and they didn't do anything, you're still fine to make a move for them in January or February. There, I just got I was having trouble getting my slides to work, but they're working now, so this is great. Gonna make it a little easier for me. Okay, extra help. So if you have extra help, you can change what's one change per quarter for the first 3 quarters if you're currently on extra help. So first, second, and third quarter, somebody has extra help, you can make a plan change. They can change anything they want. They cannot use a current extra help election in the 4th quarter, remember. So if it's in the 4th quarter, they're just gonna have to use the regular AEP election for a January 1 effective. If you're losing extra help, that's different. If you're losing extra help, you have 2 months to make a change. It doesn't matter when it is. And if you're awarded extra help, so let's say somebody has no help at all, doesn't matter when it is. Maybe it's in November. They have no help at all, but they then start receiving extra help. That is a 3-month period to make a plan change or enroll. So the only time it's limited to the first 3 quarters are existing extra help people. SPAP are state pharmaceutical assistance programs. A lot of states have them. Connecticut's a good example. New York with Epic's a good example. If you're in a SPAP program like Epic, you have a one time per year election to make a change, to enroll or make a change. Trial right is one that people forget about a lot. So there's 2 of them, and they can be used. They're very helpful. The first trial right you have is if you enroll in an MA when you turn 65. If when you turn 65, you take an Advantage plan, you have 12 months then, if you don't like that Advantage plan, to disenroll from it, go back to original Medicare and enroll in a supplement and a drug plan. And it's the first of any month for the first 12 months. The other trial right, because there's 2 of them. So the first one is MA when turning 65, and it's got to be when turning 65. Don't get caught with that. I've had it in the past personally. A couple people that were new to Medicare when they were 67, and they took an MA plan, and I tried to use the trial right. It won't work. It only works if they took an MA when they turn 65. The other trial right is one that we can utilize as agents a lot. That is if somebody's been in nothing but a Medicare supplement plan since they've been eligible for Medicare, and they decide to try an MA for the first time, they also have a 12-month trial right. So Ed's turns 65 and enrolls in an ARP plan G. When I'm 68, Paul comes to me and says, hey, you got to try this Advantage plan. I try it for the first time. I have then 12 months, if I don't like it, to switch back to my original supplement and a drug plan the first of any month during those 12 months. It can be really useful for getting people to try MAs if they're a little hesitant to try them, because they can make a change if they don't like it. And then if they don't like it and they make a change, they want to change back, you can be the one who writes them back their supplement. 5-star plan's a pretty easy one. Obviously, this kind of goes along with our IESNP plan we have with United Healthcare, which is 5 stars in every state but one. In that election, you have a one-time election and a 5-star plan to make any change you want, and that runs from December 8th through November 30th every year. So then there's new ones. These came about from the last round of changes that CMS made. And this is exceptional circumstances, SEP. So basically, if you experienced as a consumer exceptional circumstances, now what's exceptional? I don't know. I really don't know what that is. Some days I feel exceptional, some days I don't, but you have the right to ask CMS to grant an SEP because you experienced exceptional circumstances. I don't really know what that is. It doesn't clarify. It does give a couple strange examples, but it is an option. And from what I'm being told is if the client takes the time to call CMS, they're going to be granted the exceptional circumstance. Just be careful. I would not recommend calling in with the client. A lot of times when that happens, even though the agent's helping the client, CMS seems to take that and just generate a sales complaint versus the agent, even though there was no complaint. So be careful with that when you're calling CMS with a client and calling a carrier. We've had a lot of people with clients calling carriers to help them, and then lo and behold, it suddenly just comes out as a sales complaint for no good reason. And then you got to answer all the questions. I mean, no trouble comes of it, but it is a hassle, really, more than anything. There's a special election now for misleading marketing. So if the client is given misleading information in the marketing of a plan, they have a one-time change if the regional CMS, so the regional CMS office, your local one, if the regional CMS office determines that a violation occurred. So an example of that would be a client who goes down to a CMS officer, calls and says, somebody called me on the phone. I have no idea who they were. They had no permission to call me, and they enrolled me in a plan over the phone. It's the wrong plan for me, and they misled me. Well, they will then, and we've seen examples of this, CMS then will grant them an extra election to make a plan change. Get to the FEMA declared emergency or disaster. This one's important. You can use this a lot. There are currently over 40 different SEPs currently across the US because of declared emergencies or disasters. Now, some of these are county specific, so it'll list like Florida and say 2 counties in Florida. A lot of times though, it'll say the whole state. So I won't read them off. I don't know my abbreviations for my states anyway, so I'll just screw it up, but you can look at it. So there are currently elections because of emergencies or disasters in all those states listed. I wrote that this isn't an exact science. It isn't, because just because FEMA has declared an emergency in a state doesn't necessarily mean that all the carriers are going to acknowledge it. It's hit or miss with that. Sometimes it's just trial and error. Is Humana, there's a gun violence election in New York, for example. Some carriers will honor it, so you could put SEP gun and it'll go right through. Other carriers will not, but you really just don't know until you try. But to see where these current disasters or emergencies are, you can check the FEMA site, and it's easy. It's FEMA.gov is the site. Click on the Disasters and Assistance tab, and then click on the General Disaster Information tab, and then just search disasters. When you go through this, just make sure that the disaster you're looking at is an active one. So it'll say, the FEMA site's weird. It'll list disasters that happened 15 years ago, and it was, only active for a year. So just make sure to look at the end and make sure it's still an active disaster or emergency. And you can search state specific on this as well. All right, I'm trying to remember why I even put unrelated to FEMA. Okay, I just threw this in here randomly, I guess. Remember, if somebody's enrolling in Medicare Part B, that is not an election for D. So let me explain. You get somebody who's on Medicare A only. I've done this one wrong. They're on Medicare Part A only. They get Medicare B, and you're thinking to yourself, and they want a drug plan, and you're like, oh, well, they have an election now because they got B. It's not. You're eligible for a drug plan with A only. So getting B does not create an election for a Part D drug plan. All right, I'm going to focus on Part B enrollment periods now. Obviously, for Medicare Part B, you have the initial, the IEP. That's somebody turning 65 or on Social Security disability for 24 months. They got to be on Social Security disability for 24 months to be eligible for Medicare, but they can then prior to the age of 65. And they have a 7-month period, basically, to enroll in Part B. Pretty straightforward on that one. People can sign up for Part A, believe it or not, anytime. So if they didn't take Part A, at any point they want, they can sign up for A. It's B that you need an election for, and I'll get to that in a minute. Just something to note, when you sign up for Part A, they will retro it back 6 months. So let's say you're 66 and you sign up for Part A, they will retro that A effective date back 6 months. And this is why you always see that notice saying, don't make HSA contributions if you're on Medicare A or B 6 months prior to getting A or B. And that's because of that 6-month retro opportunity on A. And just to reiterate, clients cannot contribute to an HSA if they are enrolled in A or B. They can have money in it, they can use the money, but they can't make contributions. It's a heavy penalty from the IRS if they do so. So just keep that in mind. Then you have the Part B general enrollment period. That's changed a little in the last couple years. The Part B general enrollment period runs from January 1st through March 31st. That is for somebody who wants B, right, and they don't have an election for it. It used to be, and I'll use an example, somebody decides in June they want Part B, but they have no election for B. They just want it, then they need it. They have to wait till January 1st to March 31st to apply, and in the past, that B didn't go effective until July 1st. Big change now to that. That B goes effective the first of the next month after they apply, but they still have to wait till January through March to do so. If somebody's drawing Social Security payments, they're auto-enrolled in A and B. I get that a lot. So somebody's turning 65, they already are drawing Social Security, they're going to get their Medicare card automatically. If they're not drawing Social Security payments at the time they turn 65, they need to apply. Okay, delayed Part B, we'll hit that. Remember, there's waiver criteria. There's 3 main criteria to waive Part B validly, and we're going to hit those. So somebody says to you, well, I'm going to turn 65, but I'm still working. Can I waive Part B? And the answer is yes. They can waive it without any penalty, without missing their B election, if they're meeting the 3 criteria. This is either themselves or through a spouse. They've got to be working. They got to be getting coverage through the employer they're working for. And the group has to be 20 or more. If they meet all 3 of those things, then they can waive Part B. If they're not meeting one of those 3, they can't. So give you a quick example. Don turned 65. He's still getting coverage through his large group employer, but he's not working anymore. And Don says, well, I don't need Part B. He does, because he's not working. So that is his election period for B. That is his period, his 8-month period to sign up for B. If he misses that, then he can't get B. He has to wait then until the Part B general election period. So you got to be meeting all 3, either through yourself or through your spouse. And just to hit quick on that working, coverage through work thing, we've had scenarios where somebody is working, they're getting coverage, but not through their work, it's through a different employer. That doesn't count. The coverage has got to be through the employer either you are working for or your spouse is working for. So group plan and or employment ends. If that happens, you have 8 months of, if the group plan ends, if you lose coverage, or employment ends, either or, then that triggers your 8-month period to sign up for B. And there's the forms you use, a 40B and a CMS L564. The CMS L5, the form 40B is the Part B application. The CMS L564 is what you call the employment verification form. That's the form that the Medicare needs to see from the employer showing, yes, Ed is 68, he's asking for Part B, but he's been working and getting coverage through us the whole time, and we're a group of more than 20 or more. Just to make things confusing, just remember COBRA is not a B waiver, because you're not working if you have COBRA. So the requirement's not being met. So people being on COBRA is not a valid waiver for B. However, again, to be confusing, COBRA is a valid waiver for D as long as it has a credible drug plan in it. So just different, make the distinction there. Here's some other special elections for B. Some of these are new. If somebody lost Medicaid on or after 1/1 of 23, they have 6 months to enroll, and that's a new form, CMS 10797. But they lost Medicaid, they're 65 or older, they didn't take Part B, they have a 6-month period to do so using that form. Whoops. There we go. Other weird B elections. So you missed your B election due to a declared emergency. So if you had a FEMA declared emergency or disaster, and you missed your B election, you can appeal, and people do win on that. Released from incarceration, that one does come up as well. Believe it or not, even though somebody, when they're incarcerated, isn't using Part B, they're supposed to keep it. However, now, if you're released in the past, being released from incarceration did not create an election period for B, it does now. So technically, that person now can disenroll from B while they're incarcerated, and then being released will trigger an SEP for them to get B. Exceptional circumstances. Again, no definition of what that means. Exceptional is pretty subjective. So I can't really give you much more to go on with that. That's something where they would have to appeal to CMS and explain how exceptional their circumstance was and get a special election for B. Inaccurate or misleading information. That is usually regarding the employer. So that's saying that the employer either didn't tell me, hey, you're on COBRA, you need to sign up for B, or we're a group of less than 20, you need to sign up for B, and they can appeal then. All of these weird kind of new elections for B, all are 6-month periods to elect Part B once that they occur. And again, they all use form CMS 10797. A couple reminders. MA and MAPD delayed Part B enrollment is prior to the B start date. That's a big one. So for example, somebody gets Part B, they're 66, and they get Part B for a June 1st effective date. I even sometimes think to myself, oh, they've got 60 days using the ISEP to get an advantage plan. They don't. When you're delayed Part B, that MA or MAPD application has to go in prior to the B start date. Now, if they lost employer coverage, you could use the loss of employment SEP, because you got two of them there. You could use the loss of employment SEP, and that'll give them then 2 months to enroll in a plan. But if they weren't employed, they just got Part B, remember that MAPD plan's got to go in prior to the B start date. The other really confusing thing is, because believe it or not, it's confusing because losing COBRA does count as an MA SEP. So COBRA is not a valid waiver for B, so you can't get B because you lost COBRA. However, losing a COBRA policy is an election to enroll in an MA plan. Two different things. It's hard to make the distinction sometimes. Okay, that's done. I'm done. A lot of talking there. I'm going to see if we have any questions. Let me take a look. We do. We have some questions. Okay, somebody asked, do you have to say the Medicare disclaimer on every call? Yes. If you are soliciting someone, you have to read them the disclaimer. And that's why you'd use a Sunfire, because it scripts it for you. It gives you the disclaimer. So you do have to read the disclaimer. Now, if you're calling an existing client just to tell them about their existing plan, technically then that is a service call. It is not a solicitation. The disclaimer wouldn't be needed there, but I would just read it and get the recording just in case. Better safe than sorry. Okay, a long question. I'm going to try to, potential client turned 65 October 2023 and got his Part A at that time. He had covered for the last 18 months. He received his Part B on January of 2024. I believe he has February, March, and April for a Medicare supplement plan. Yeah, actually, he's new to Part B, so he has a GI for Med Sup, and he actually has 8 months to get a Med Sup. However, I believe because the plan is not credible, coverage for the Advantage plan with a drug plan or PDP plan, he only has until January. Yeah, so this is an example. So this person is a late Part B enrollment. His election for an Advantage plan, if you're using the ISEP, it's got to go in prior to that B start date. Hopefully that answered your question for you. I don't think we have any other questions. It looks like that's it. Okay, great. Want to just mention one other couple quick things. Again, YouTube watch, we got a lot of videos on there. Got a video on all the programs we offer, the UHC ISNP Care Advantage iSNP, that's the one with the super low out-of-pocket 5-star plan. Oh, I see another question. I'll hit that in a second. And also, we have a group dental plan offering. It uses Delta's network. It's for individuals. It has no waiting periods. It's a 180/50 plan with no waiting periods. And again, it's Delta's network. Really good plan. You can get set up to sell that. Just inquire with us if you want to. So huge network available in all 50 states, no waiting periods, and uses Delta's network. It's a unique plan. So we have that available for those who are interested. Can a person waive Part B penalties is the question. No, unless the only way they could waive them, so to speak, is if they had an appeal to CMS and could prove they had an exceptional circumstance, then they potentially could waive them, or they would waive them, so to speak, if they had any level of help, whether that be drug help, ALMB, SlimB, QuimB, or if they're a full dual, then that would waive the B premium and penalties. Other than that, though, it'd have to be an exception to CMS for exceptional circumstances. It looks like that's all we have. Great, thank you for coming on. I appreciate it. Well, last quick thing is we're going to start our Zoom meetings again. Those are our agency Zoom meetings where I'll come up, I'll just take 5 minutes, 10 minutes to talk about updates and current topics. And then it's interactive. We go back and forth, answer questions, things like that. So be on the lookout for those. We're probably going to start those up next week or the week after. Other than that, thanks for coming on today. Really appreciate it. Call us or email us with any questions. And I hope everybody has a great day. Thanks.